Hello, my name is Philip Mons. I'm a professor of healthcare and nursing science at the universities of Leuven, Belgium, Gothenburg, Sweden, and Cape Town, South Africa. I'm pleased to present here at the ESC Congress 2020, the digital experience. And the title of my presentation is Physical Activity in Adults with Congenital Heart Disease. I do not have any conflict of interest regarding this presentation. Talking about physical activity, the first question we will ask is, to what extent are patients with congenital heart disease, performing sports in their day-to-day life? What are their habitual activities? And so far, a lot of studies have been investigating this, and it would lead us too far in this presentation to go over all of them. But one particular study that is of particular interest is Approach-IS. This is a large-scale international study, including more than 4,000 patients coming from 15 countries. And in Approach-IS, we found that 43% of the patients indicated that they were engaged in sport activities. However, when we looked at variation across the countries, we found a huge variation, ranging from 10% in India to 66% in Norway. This means that single-center studies or studies that have been conducted in one particular country cannot be generalized to the global population of congenital heart disease. Approach-IS also looked at the recommended level of physical activity from the WHO. WHO indicates that it is advised to perform activities more than 3 metabolic equivalents for 2.5 hours per week at least. And in this group of patients with congenital heart disease, 31% indicated to reach this recommended level of the WHO. But also here, a huge variability across the countries. Once again, going from 10% in India to 53% in Norway. When we compare these numbers with the general population, we see that it is quite in line. In other words, patients are doing more or less the same in terms of habitual sport activities as the general population, which is in itself relatively good news. Question is, who are the patients who are not reaching this recommended level? Risk factors for not reaching this level are female sex, older age, lower education, job seeking, unemployed and disabled, New York Heart Association class 4, and complex heart defect. So here you see that both demographic factors play a role, but also some medical factors. And I'll come back to that later on in this presentation. Bear in mind that studies on habitual activities mainly rely on self-report. And from a Swedish study, we know that people overall overestimate their physical activity level. So these Swedish researchers found that 71% of their cohort reported to reach the WHO recommended level of physical activity. However, when these patients were asked to use an actigraph measurement of the heart rhythm, the researchers could infer that only 48% was really reaching this recommended level, showing that there is clearly an overestimation of physical activities when you rely on patient report. Okay, habitual activities is one thing, exercise capacity is another thing. Do patients with congenital heart disease have limitations in terms of exercise capacity? And in 2017, a meta-analysis was published in this respect. And this meta-analysis showed that the pooled estimate of VO2 max in adults with congenital heart disease is about 9 milliliter per kilogram per minute lower than in healthy controls. So the exercise capacity in people with congenital heart disease is indeed lower than in the general population or in healthy controls. However, there is also variability within congenital heart disease, as shown by these data from the Brompton. On the top of this graph, you see the data from arterial switch after transposition of the great arteries and valvular, and more than half of the patients is situated at the right of the green bar, which shows that more than half of the patients do have normal or borderline peak VO2. Only a limited number of patients from this group were situated at the left of the right bar, indicating severely impaired. However, when you look at the bottom of the graph, Epstein, Fontaine, Eisenmenger, then you clearly show that there are more patients that are severely impaired. So it's not only about the group of congenital heart disease patients that are doing worse, there is variability within the population of congenital heart disease as well. Of course, the heart plays an important role in this matter, but it is not only about the heart. It's also about peripheral muscles, as shown by these two examples of studies that indicated that the muscle function, the skeletal muscle function and oxygenation in people with congenital heart disease is impaired. So both the cardiac reserve and the peripheral muscle function plays a role in a reduced exercise capacity. What is a solution? Can exercise training be a solution in this matter? And the answer is yes. A meta-analysis that was published in this matter showed that exercise training in adults with congenital heart disease is safe, no adverse effects, and it is effective to improve cardiorespiratory fitness. However, the studies are of moderate to low quality, and there is a big caveat: the adherence to the intervention is low. This means that people with congenital heart disease quite often drop out of the cardiac rehabilitation. And one solution for this could be home exercise training. And also in this matter, a review was published. And this review also showed that home-based exercise interventions are safe, and it is effective to improve exercise capacity, walking distance, and quality of life. However, also here, the studies are of low quality of life. And although you would think that the adherence to the intervention is higher because people don't have to go to the place where the rehabilitation is given, also here, the adherence to the intervention is problematic. Let me come to the conclusion of this presentation. I wanted to uncover in this presentation that physical activity levels of people with congenital heart disease are in line with that of healthy peers. There is a geographical difference across the globe, so you cannot generalize data from one country to another. Exercise capacity is lower than that of healthy controls, and this is because of cardiac and peripheral muscle functioning. And yes, exercise training is effective, but more high-quality research is needed. Thank you very much.